Greetings to all the learners and namaste. This is a session CIT 002 Block 2 Unit 4, the 20th session from the course Certificate in Information Technology. And the topic of this session is ICT in medicines. This is the second part of this series. The first one was session 19. To recap, what do we mean by ICT here? ICT refers to information and communication technology, which means everything that has to do with, say, mobile phones, computers, software, multimedia, teleconferencing, the internet, and so on. ICT has revolutionized many areas of our life. We experience that virtually every day. But in this session, we are going to look at specifically the changes and the transformation that ICT has brought about in the medical field. Some of those pertain directly to us as patients or as laymen, and in some of those are felt by professional providers of medical facilities. So, let's take a brief look at some of those areas. We have already seen some in the earlier session. Let us now look at some more areas where ICT has transformed medicine. One is evidence-based medicine. We will come to what it means a bit later. Telemedicine, then the use of electronic mail in public health, in e-prescriptions or electronic prescriptions. The whole health insurance industry has changed because of ICT, and the spawning and formation of many different online support groups to help people with medical problems has come up. These were not things possible earlier before the advent of computers and IT. So, what do we mean by evidence-based medicine? See, when we go to a doctor, the doctor gives us, he examines us, and he comes to some conclusions based on his medical knowledge that he has gained over the years and through his practice. And of course, through whatever he might have read, because a doctor has to keep learning all his life, all their lives. Evidence-based medicine is using the available medical literature for taking patient care decisions. So, it's a system of practicing medicine where you rely not just on your own knowledge and your own practice, but also on all the available body of literature to take decisions. So, you are able to use the latest findings and discoveries instead of limiting yourself to what the doctor knows. It of course means that the doctor is committing to lifelong learning, which was the case anyway, but it's now really something that hits us home. A doctor has to keep learning all through their life. Moreover, evidence-based medicine will also take into account patient values and preferences, and there may be certain kinds of procedures that a patient may not want to take. He would like to look at alternatives. So, such preferences can be taken into account using evidence-based medicine. ICT makes the practice of evidence-based medicine easier. How? By giving the doctor the ability to search through the medical literature much more easily than they could. So, medical papers, libraries, or any other experiences of fellow physicians, these are all easy to look for using ICT. Earlier, a doctor could only perform a limited search based on books or journals that he had access to. So, decisions therefore about what kind of treatment to be given to a particular patient depend on available literature and medical evidence, on of course on the doctor's own knowledge and experience, which is paramount, and the patient themselves. So, this makes for much more specific analysis and diagnosis of a condition and a much more specific line of treatment based on the patient's precise condition and preferences. There is also a very exciting new area that has come up largely because of the advent of ICT. This is telemedicine or providing medical care from a distance. How is this done? It is done using video conferencing. It can be done using the internet. Let's say there is a primary health center in a remote village somewhere. This is staffed by paramedical staff, paramedical people, but there might not be a qualified doctor or not to speak of a specialist here. So a patient comes in with some condition and let's say there is a patient suspects a fracture, then an X-ray is taken, but there is no one available who can diagnose what needs to be done, what has happened and what needs to be done. So these images can be presented to an orthopedic surgeon who may be located in some nearby city. That doctor can then look at the image and guide the paramedical staff on the action to be taken, and if required, he can recommend that the patient be brought to him. So the reach of specialists is greatly enhanced by telemedicine because it's no longer limited to their clinic or to their geographical location. In these stressful times, mental health is becoming a matter of concern. While there is a stigma attached in our country and in many other countries to seeking advice for mental health issues, this is breaking down slowly and people are becoming more and more open to seeking help for mental problems, stress and being depressed. These are very common conditions, unfortunately, which are growing in number and severity. Psychiatric counseling lends itself very well to remote delivery. There are sites, websites and other facilities where you can seek the help of a psychiatrist through the anonymity of a video conference. Pathological analysis, certain kinds of tests can be performed remotely by an expert pathologist as long as there is a trained paramedical staff available who can prepare the sample for analysis. So, for example, if there is some blood test to be done, then the paramedics can prepare the slide and a pathologist can observe that from a remote location. Monitoring of patient condition can also be done from a distance because the readings of the various instruments can be transmitted to a nurse or to other medical staff who are located far away. One of the best things about telemedicine is that it reduces cost and it makes available scarce specialists to serve a larger area. The difficulty with telemedicine is, of course, where face-to-face physical examination is needed, and also regulatory and legal issues. So, unless there is a robust regulatory legal framework, telemedicine can become difficult or even illegal. But many developed countries, the US for example, encourages telemedicine. There are some countries which have laws that any condition that can be taken care of through telemedicine should not require a clinic visit. Then let's look at email in medicine. I'm sure many of us use email these days. Virtually everybody who has a computer would be using email. We often get messages and send messages. This can be also used for medical advice. So, a patient can describe their complaints, the doctor can give instructions based on whatever they diagnose the problem to be. So, this is more accurate and permanent compared to an oral consultation. You go to a doctor, he will tell you something, he will give you advice, and you may remember some of it and you may even forget some very important parts of it unless it's written down. So, written communication is always much more exact than oral or verbal communication. So, when something is sent to you by a doctor in writing, in email, you know that you won't forget, and if you do forget, you can refer to the email again. Also, it becomes easier to have more frequent interaction because every consultation may not require a visit to the clinic. You can get information on the test results, you can get information on patient care, like what kind of medication is to be given, when it is to be given, how it is to be given, what should be your diet, and many other such things can be provided by the doctor over mail. And you can also be given educational material, general information about your condition, so that you are better informed and better prepared for whatever difficulties or problems you might face because of your condition. Public health is an area where ICT has had a very, very major, very big effect. It's now, because of the internet and the various platforms available, particularly social media platforms, not to speak of websites, dissemination of information to the population at large in the case of widespread conditions is much easier now. So, administration of the response to a public health problem is much easier. If you have a fear that a particular disease like dengue is going to become prevalent in your area, the government can spread knowledge, information, and various kinds of data about what to expect, what to do, how to prevent it, and so on. Earlier, dissemination of information was not so easy. And as a disease strikes a community, then storage and retrieval of records of how the disease is progressing, how it is affecting people, whom it is affecting more, whom it is not affecting so much, and so on, can be, this kind of data can be gathered, processed, and used by the government, public health officials to they can use then software to decide on or to predict the progress of the epidemic, and that can also help in deciding on what kind of preventive measures are to be followed. For example, in the pandemic that the world faced, the COVID-19 was affecting a lot of people. Computer models helped decide that social distancing, keeping far apart or keeping a certain distance from others would help in reducing the spread of the virus. This kind of modeling, this kind of software, this kind of data gathering abilities were not there before ICT became available. In epidemics 50 or 100 years ago, we did not have these kind of facilities. Then when treatment is started, you get to know using ICT and computer software, which are the people more at risk? Which is the segment of the population that is more at risk? Which is the segment of the population that is more liable to or more at risk in succumbing to this disease? Where will it have more serious effects? It is now also possible to find out the different variants of the bacteria or virus that is spreading, and you know the source from where the infection comes. You can try to locate the source from a study of the variant of the pathogen that is infecting people. Naturally, a collaboration between doctors and professionals in different parts of the world becomes far easier with the availability of ICT. These technologies help people talk, discuss, exchange information much more easily. Electronic prescriptions are another small but transformative advance. Earlier, the only way of getting a prescription was a prescription that was handwritten by the doctor, and it had, as we all know, certain problems. Sometimes it was difficult to read or decipher what the doctor had written. Sometimes even trained pharmacologists or chemists would confuse medicines because of handwriting, and they had to sometimes actually talk to the doctor to find out what they had actually prescribed. But with electronic prescriptions, this problem is solved because the doctor enters the prescription into the software instead of writing it down. As soon as it is put in the software, it becomes available to your pharmacy, to your chosen pharmacy. And in developed countries, privacy and security concerns are taken care of by making sure that such kind of transmission of information happens only over a secure computer network. So you can go to your pharmacy and simply purchase your drug because they already have the exact prescription available with them. If required, you can print the prescription and it would come with a barcode which any pharmacy could use to retrieve that prescription from the repository. So this also saves us the problem of lost prescriptions or forgetting to carry your old prescription the next time you go for a visit. This is something that certainly happens to me when I go to a doctor. I often forget to bring my old prescription, and that constrains the doctor because he cannot see what was my past record or what medication was given in the past. With electronic prescriptions, the doctor will have a full record of all the prescriptions that he has issued to you. One area where a big difference is being made by ICT in the field of health insurance. Why is health insurance so important these days? It's because of the growing cost of health care. Many medical procedures and treatments are so expensive that not only the poor but even middle class people would find it very hard to afford the cost. So most of us go for health insurance. So the issuing of policies and payments, renewals, these are often now done online by these health insurance providers. The coverage can be cashless or as well as based on reimbursement. So for example, in the US these days, many claims are filed online and settled online. Supporting documents, instead of giving paper copies of each of them, they can be transmitted electronically to the insurance company, and the supporting documents such as test reports, prescriptions and so on can be electronically delivered. So this makes it easier for the company to decide on whether to pay up a claim or not, and this reduces the various possibilities of lost papers, misplaced files and so on. not to speak of the speed with which these things can be done. Cashless claims is another area that has now become possible because of ICT. So, in a cashless claim, the insurer simply has to go to the hospital, to one of the hospitals that provide cashless service for that insurance provider, and then when you go there and after you are treated, you don't have to pay and then get reimbursed by the insurance company. You can simply walk off because the rest of the process will be taken care of by the hospital in conjunction with the insurer. So, this makes the whole process much more easy for the patient. These days, many online support groups have sprung up over the net. What are these? These are groups of or a small community of people, families, individuals who are suffering medical problems or who have been through a difficult medical situation and have come out of it either with a favorable or with an unfavorable outcome. So, people who have and are facing medical problems, either themselves or their dear ones, they undergo a lot of stress. They need a lot of advice, they need a lot of support, emotional support as well as practical, what do I do now kind of support. This is best provided by other people, ordinary people who have gone through similar problems. So, it can be people who have suffered, say, because a loved one had cancer and maybe the loved one got cured or maybe they did not survive. In either case, the experience of others can be of great value to people who are now facing that same situation. So, people can advise one another about where to go, which doctor is better, which hospital is better, where they feel more comfortable, and what kind of treatment worked better for them. Not only the treatment itself, when a person is faced with a medical emergency or with a medical problem, which is not going to go away tomorrow. Many medical issues last for weeks, months or years, and it becomes very difficult for a person to undergo all this stress and all this trauma without getting help from others. You may not be able to do it alone. You need the help and you need the guidance, you need the support and advice of people who may have faced a similar situation in their time. Online support groups are forums where such advice and hand-holding and sympathy and support can be available. This gives us the courage to face up to a very difficult situation, which one may find very difficult to do all alone. One can ask specific questions, get answers from people. Of course, different people would have had different experiences. You may get conflicting advice, you may get advice which you may not like or you may not want to follow. Of course, what to do is up to you, but you have to be aware that there can be many different kinds of people and different things may have worked for different people. People may have different preferences as to how they approach things. So, it's not as if the answers you get in such a support group will directly apply to you every time, but at least they can help you take a decision on what you should do. And it's not uncommon for professional counselors to guide and serve as advisors in the group. In some cases, it's a purely self-help group, which means there is no professional involved and everything is being taken care of by laymen who have faced those problems. So one example of a support group could be something that helps you deal with cancer. And cancer causes, the treatment of cancer itself causes various side effects. And how do you cope with, for example, losing all your hair through chemotherapy? So others have faced these problems. They have had certain thoughts and emotions about it. They can guide a person who is just starting to face this situation on what they should do. And they can give a lot of encouragement to people. So in this session, we have looked at many other different applications of ICT, that is information communication technology. So we looked at applications that are specific to medicine, for example, evidence-based medicine or telemedicine or the usage of ICT in public health. We also looked at some general tools and technologies that can be used for medicine but can also be used in other areas. For example, electronic mail for better communication between the doctor and patient, electronic prescriptions for better and ease of using prescriptions and also as a record keeping mechanism. Then health insurance, purchase of health insurance, and in claim settlement, we have seen how ICT is used there. And also it can help, there are online support groups that can help a family or an individual going through medical difficulties to cope with their situation in terms of advice, support, encouragement, and general guidance. So I hope with this session you have a much better idea now of how information and communication technology is transforming, revolutionizing the practice, education, and delivery of medicine. Thank you.